just think there are lots of grandparents out there in this country, like me, I have 6 grandchildren, that what we all care about and what we love more than anything are those children. And I want to, live smart and see through this, but I don't want the whole country to be sacrificed. Let's get back to work. Let's get back to living. Let's be smart about it. And those of us who are 70 plus, we'll take care of ourselves, but don't sacrifice the country. Don't do that. Don't ruin this great American dream.
You're basically saying that this disease could take your life, but that's not the scariest thing to you. There's something that would be worse than dying.
Yeah, and look, I'm going to do everything I can to live, but, if you said, are you willing to take a chance, and, if I get sick, I'll go and try to get better, but if I don't, I don't.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting. A lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem.
We can't shut in the economy. The economic cost to individuals is just too great. So let's see how this thing plays out. More testing is essential, and we're loading up with tests now. That's going to be a big help. But the president is right. The cure can't be worse than the disease, and we're going to have to make some difficult trade-offs.
But there's a much better way to flatten the economic curve. Dr. Fauci says he's fine, overreacting. Well, that's easy for him to say. He'll still have a job at the end of this, whatever happens. Our ruling class and their TV mouthpieces whipping up fear over this virus, they can afford an indefinite shutdown. Working Americans can't. They'll be crushed by it. You know that famous phrase, the cure is worse than the disease? That is exactly the territory we are hurtling towards. You think it's just the coronavirus that kills people? This total economic shutdown will kill people.
Yeah, my mother is not expendable. And your mother is not expendable. And we're not going to accept a premise that human life is disposable. And we're not going to put a dollar figure on human life. The first order of business is save lives, period, whatever it costs. Now, I also don't believe it's an either or. I believe you can have an intelligent, refined public health strategy. You can do both, but not in a clumsy, ham-handed way. Right? Well, we'll just sacrifice old people. They're old people anyway. And the old get left behind. What is this, some modern Darwinian theory of natural selection? You can't keep up, so the band is going to leave you behind. We're going to move on. And if you can't keep up, well, then you just fall by the wayside of life. God forbid.
No option to just let everyone go back out and go back to normal if a pandemic rages across the country and infects 50% of the population and kills a percentage point at the low end of those infected and also melts down all the hospitals. What kind of economy do you think you're going to have under those conditions? I mean, please just think about this for a second. Are people going to be flying? Are they going to be going to Disney World? Are they going to be going to restaurants and bars? Are you going to be able to run a business if 2/3 of your staff get sick and the virus comes whirling through your workplace and mounting horror stories come out of hospitals every day? And maybe it goes through the places of where people maintain the grid or the water treatment system. As the Prime Minister of the United Kingdom orders a countrywide lockdown for the next 3 weeks, after resisting the idea, the President of the United States appears to be just considering the opposite. Okay, enough of that. let's take our chances with the virus.
Dr. Birx or Dr. Fauci are telling you we need to continue these measures for the health of the vulnerable populations of the country. Are you going to say, I'm sorry, that the economy is too important?
Well, you'll see what happens. I understand the question very well. It's a great question, but we can do two things at one time. The number of jobs, almost 160 million. So we can't turn that off and think it's going to be wonderful. There'll be tremendous repercussions. There will be a tremendous death from that. Death. You know, you're talking about death. Probably more death from that than anything that we're talking about with respect to the virus.
Do we have to shut down the whole country for this? I think we can get back to work.
I think it's worth recognising just the level of anxiety really amongst disabled and older people and their families, and trying to follow government advice at a very difficult time. So, I mean, there are a number of things that I just want to raise on behalf of disabled people and older people and carers. And one of the things is that they're having to make some of the most difficult decisions of their lives. So to give you an example, somebody working in NHS, for example, having to come home to somebody who is on the shielding list. Their concerns about PPE, about transferring and infecting people, people wondering whether they should give up work to care for their relative because they're concerned, people very worried about people coming into their house and passing on infections, and of course the services that are so important to people's lives are changing daily because of the availability of other staff.
Right, so when were you told a fatality happened? Because the man that was, the homeless man that we are told that just died, we've just seen the police take him away to the hospital. I'm filming this now. The police were just, you're in your communal area, my building, and you're lying to us, spreading fear, telling us that this man died, and he's just been down there and saw that he is not dead, he has just been taken to the hospital by the police. He spoke to both the police and the homeless man. That man was a bit drunk, he asked him if he was okay and he was fine. This was 5 to 10 minutes ago, and now you're coming up here spreading lies and fear and telling me this man is dead, and he is not dead. This man is not dead. Take them letters, take them somewhere else, because that man is not dead. I've been feeding that man.
Wait.
He's lying.
What you can do is stop putting it. We can stop putting it on because he's not dead.
Until you find out if this man's really dead and prove that, then you need to stop putting these letters on there.
Can I ask you to stop filming?
Can I ask your name?
I'm from One Housing.
You're from One Housing. Can I ask your name? When they put a letter under your door saying the man's dead, he's not dead, he's fine. The man is absolutely fine. The man's fine. He's putting letters under our door saying the man's dead. The man's not dead. He just saw him 5 minutes ago being taken by the police. Now these are coming here in their little suits telling us this man's dead, and this man is not dead. We have just seen the police take him to the hospital 5 minutes ago. You are liars. You are spreading fear for no reason. No one died in this building today. Nobody died.
Can you let us respond?
Yeah, I have let you respond, and you've stood there and lied. You have?
You haven't given me I said, can you stop filming?
Okay, no. You're in my building outside my door causing fear amongst my community.
Right.
Okay, go on. So show me who died.
Okay.
It's legal. I'm illegally allowed to.
Speak, please.
Go for it. Go on. I did.
No, you didn't. Can you stop filming as well?
No, go on.
Right, in that case,
I can film. Go on. I'd like the answer.
We responded based on a report we had earlier.
What time did you get this report? Can I just ask?
About a couple of hours ago.
A couple of hours ago, but we've literally saw this man taken away 10 minutes ago, healthy.
That's fine. Now that you've told us that, we will go on.
Can I ask who gave you the report that this man was dead?
It's fed from One Housing.
From One Housing. One Housing told you that this man was dead, so you came round in your suits to spread fear amongst, look at them, children in there, and you're spreading fear amongst all of us.